Let's bring in our panel of Bryson Head, the LNP member for Callide, and Alecia Staines from the Maternity Consumers Network. Thank you so much, both of you, for your time. Alecia, how is this affecting women and families in rural and regional parts of the state?
Oh, it's extremely traumatic for them. I know you mentioned around having to relocate to Rockhampton. Some of these women are actually going further. I know of women who've gone to Brisbane, Sunshine Coast. Some of them are going to Bundaberg too, because it depends where they've got family. These women need support, and trying to relocate to a town that they perhaps don't have any family or friend link is extremely difficult for them. So they're absolutely displaced for their births. The financial pressure, the emotional stress is absolutely huge. And we're now in the hundreds of births that have happened under these circumstances.
Oh, gosh. Bryson, rural and regional population growth is essential for Queensland's economic future. What is Labor's indifference to the needs of mothers outside the cities doing to the ability to attract skilled men and women to set up their lives and their livelihoods in the regions?
Well, Amanda, I just want to make one comment on that as far as rural growth. It is absolutely important to the future of Queensland that we provide basic services at what is a core medical service to rural and regional communities. So Chinchilla is the bottom end of my electorate. Its population has doubled in the last couple of decades, and yet it's lost its maternity service in the same time, which comes to the core of the issue that the Labor Party and the Labor government, the Labor Palaszczuk government, simply does not care about the future of rural and regional Queensland, and they continue to strip away our services even when we do have population growth. And a newly qualified obstetrician isn't going to pack up their family from wherever they are and move to a rural and regional community when the government has sent a clear message that if they do that, they don't have a future there.
Yeah, it's a good point. Alecia, I've been really blown away by the work that these rural communities do to keep quality services in their towns. And one example that I saw with you during Labor's push to close the Theodore birthing suite was that the local community had, about a year before, fundraised on its own, didn't depend on government, and paid for the upgrade of their birthing suite with new technology, only to have bureaucrats from Brisbane close it shortly after. How can we put more power into the hands of local people to determine the local services that their community needs?
Well, we really should have that, because our health and hospital boards operate under allegedly community-based infrastructure, but it's just not happening. The boards are not providing the directive. They're not enforcing things like the Rural Maternity Task Force report, which actually outlined that women should have local birthing services. Theodore now, it's been thousands of days, and they, that's one region we forget too, that these women are in central Queensland and they're also being herded into Rockhampton. So, there are easy solutions that I guess are being bypassed because it's stuck in the bureaucratic process of let's do more reviews and let's do more roundtables and this kind of thing. The answer is quite simple. We also have a private midwifery workforce that could be out there on the ground, a la Call the Midwife, servicing a lot of these rural towns.
Yeah, you make a good point. A local board that isn't able to stand up to the diktats coming out of Brisbane isn't worth very much. Bryson, this is a symptom, though, of a government that is falling apart at the seams. How is that manifesting in other areas of rural healthcare?
Well, it's right across the board. The decline of rural health services is being felt in every community across Callide and all of Queensland. And frankly, the government is not doing its job. They're not attracting staff. They're not putting their trust in the medical staff that are on the front line. We need to put nurses and doctors back in charge to fix the fundamental core of this issue. And to my earlier point, the medical staff aren't going to move to rural and regional communities if they know that the government isn't going to back them in doing that. My communities are feeling the pain. There's a lot of communities that have doctors on and off. 1 week they'll have a doctor, another week they won't. They're relying off locums, which is costing costing the health service millions of dollars unnecessarily because they're not recruiting permanent full-time staff into these communities, and part of the core of that issue is because they're not showing those staff that they're going to have a future.
Yeah, Alecia, you've been a fighter for women's choice about how and where they choose to give birth for a long time now. Labor seems to see this as just an issue of obstetrician supply. And of course, obstetricians will have a role in some cases, but midwives don't seem to get a look in the state's approach. Midwives can do a lot of what's needed in less complicated births, and many women prefer that option. Are midwives part of the solution? And if so, what do we need to do to get that over the line?
Oh, we need to start listening to women. Women have had the answers for a long time. Every state, every national review we've ever had in this country has echoed what you've said about having midwives. We've got private midwives. We've got, an ability to get private midwives on the ground very, very quickly. We know from what happens around the world, like in Inuit communities in Canada, they're 5 hours from caesarean access. Whilst that mightn't happen in Queensland and might not be an ideal, this whole rhetoric around relocating for birth is safer is not true. We saw that during the Rural Maternity Task Force, that the rates of mortality were higher in rural towns without maternity services. Absolutely, midwives are underutilised. I love midwifery care. Get midwives working their full scope of practice, get adequate transfer pathways, and really support this system to get rural and regional families the maternity care that they deserve.
Alecia Staines and Bryson Head, thank you so much for the work you've been doing on this issue, and thank you for your time tonight.